Hello, welcome to RAAONLINE. I am Dr. Raaonline. Let's discuss this very common topic called peritoneum. Peritoneum is a mesodermal derivative consisting of mesothelial cells supported by a thin layer of fibrous tissue containing vascular and lymphatics, capillaries, nerve endings, immunocompetent cells, especially lymphocytes and macrophages. Peritoneum lines the whole of the abdominal cavity. Some viscera are covered fully by this as a sheath and they are intraperitoneal. Some are covered anteriorly and hence they are intra-abdominal but extraperitoneal. There are two layers of peritoneum, parietal and visceral. The space between these two layers is called peritoneal cavity and it normally contains around 50 ml of fluid to avoid friction during intrinsic movement of the viscera. Only pre-peritoneal viscera in the whole abdomen is the urinary bladder. Omentum and some ligaments and mesentery are also components of peritoneum. Physiologically, it acts as a protective layer. Peritoneal cavity is a closed layer except in women where it is open through the fallopian tubes, uterus and vagina. This is a typical peritoneal anatomy in a female. As we said, all the intra-abdominal, intraperitoneal viscera are fully covered by peritoneum. Attachment of these structures to the abdominal wall is called mesentery or mesocolon depending on which bowel are you talking about. These are nothing but two layers of peritoneal fold containing the blood vessels and lymphatics. We'll take one after another, quickly go through the peritoneal covering of all the intra-abdominal viscera. Starting with the liver, it is fully covered by the peritoneum with a reflection onto the diaphragm in the form of left and right coronary ligaments. It is attached to stomach and the first part of the duodenum through a structure called lesser omentum, hepatogastric or hepatoduodenal ligament. It is attached to the anterabdominal wall in the form of a falciform ligament. Spleen is again fully covered with peritoneum and is attached to the stomach by a gastrosplenic ligament, to the splenic flexure by colosplenic ligament, to the diaphragm by splenophrenic ligament and to the kidney by splenorenal ligament. Stomach is fully covered and it is attached to the liver as we saw before by gastrohepatic ligament or otherwise called lesser omentum. It is attached to the spleen by gastrosplenic ligament and is attached to the transverse colon by a big sheet of peritoneal fold what is called greater omentum. Jejunum and ileum are fully covered and are attached to the posterior abdominal wall by a structure called mesentery. Again we said it is nothing but two layers of peritoneal with vessels and lymphatics. Transverse colon is again fully covered and attached to the posterior at the anterior border of the pancreas as a transverse mesocolon. Sigmoid colon is fully covered and it has got a sigmoid mesocolon. Coming to duodenum, the first part is again fully wrapped by peritoneum. The second and third part are covered anteriorly and they are retroperitoneal structures. Third and fourth part is suspended to the right crest of the diaphragm by a ligament called ligament of Treves. Ascending and descending colon are covered in the front and both the sides by the peritoneum as they are retroperitoneal.